Hello everyone, I'm Liz Ayers. Welcome to this edition of Focus Wellbeing, a show that deals with our physical, emotional, and financial well-being. On this episode, we are going to tackle addiction. Today, the category includes more than substance abuse. The definition has broadened to include fixations on behaviors. Someone can be addicted to overeating, shopping, exercise, or gambling. Joining us this week are Dr. Anil Verma with Psychiatric Wellness Care and Dr. Dorothy Lennon, Medical Director at Tully Hill Chemical Dependency Treatment Center. I want to welcome you both. Thank you so much for being here. Before we get started with the show, though, we would like to share the results of an unscientific poll presented by WCNY on Facebook. Yes, some people could be addicted to Facebook. The question is, other than alcohol or drugs, are you aware of the many forms of addiction? And here are the results. 75% say yes, they're aware of addiction, and it changes as gadgets change. We're going to talk about that today. So what are the most prevalent addictions? According to Brainsy.org, the top 10 21st century addictions are number 1 is alcohol addiction, then smoking, drug addiction, gambling, food addiction, video game addiction, which is amazing, internet addiction, sex addiction, shopping addiction, and work addiction, or as we say, workaholics. Dr. Verma, we'll start with you. What is addiction? What happens to somebody when they're addicted?
Addiction is a disease. It's a mental disease. Among all the addictions, alcohol is the most common addictive agent out there. So I'll try to explain it according to alcohol. So what happens, people start drinking leisurely, and after a while, they lose the buzz they used to get from drinking. So they develop tolerance. And then they start drinking more. And after a while, when they start to reduce or stop drinking, they go into withdrawal. And in order to prevent the withdrawal, they drink more. Okay, that starts the addiction. Because of the addiction, they also look for substance all the time. You know, like pain medications, addicts. They usually travel long distance to get. People who use benzodiazepines, they go long distance to get these things. They start to miss important part of their life. You know, the kids' anniversaries or holidays they miss, birthdays they miss, you know. And they know that alcohol is dangerous to them, they continue to drink. So that is addiction.
Why do some people get addicted and others don't? I mean, is there such a thing as an addictive personality?
Yes. Addictive personalities are the traits which you see in person which makes them addict. The significance is that you can pick up these people before they become addicts. And you can start early intervention before, so that you can break the cycle of addiction.
Give me some traits of a person who has an addictive personality.
The most important hallmark is they have a trouble dealing with stress. They have a poor frustration tolerance, we call. Along with that, they are very loner. They are very quiet person, socially anxious, okay. And in order to fit with their peers, they start smoking and drinking, so they get accepted. Okay.
Very interesting.
Yeah.
Dr. Lennon, you know, obviously addiction's been in the news significantly this week, and we've seen, you know, what happened to Michael Jackson in the past. You say you're seeing more people today than you saw 5 years ago. You were surprised by that, too.
Right. The numbers that we're seeing at Tully Hill increase every year. I think in addition to what Dr. Verma said, there's, when you say, can you pick somebody out, there's also a genetic predisposition. So that if your parents were addicts or alcoholics, the chances of you being an addict or alcoholic are certainly increased. Now, does that mean for sure that you're going to be an addict or alcoholic? No. But your chances are certainly increased.
That's interesting. We had a viewer question. There is a history of alcoholism in my family. Is there a relationship between genetics and alcoholism?
There certainly is. There's a genetic loading. So if your parents are addicts or alcoholics, you certainly have an increased risk.
And if your father is alcoholic, you have fourfold risk of becoming alcoholic compared to if your father is not alcoholic.
Let's talk a little bit, I mean, there's just so many addictions out there, but, we know alcoholism is the #1 addiction, according to you, Dr. Verma, and the statistics. But, people are, it's a tough world out there right now, and people are anxious. And we were talking about antidepressants, and some are addicting and some are not. My pharmacist years ago said, Liz, the #1 thing we prescribe in Manlius is hormones, and then after that it's Prozac.
Yeah.
And I thought, gee, that just says where the world is right now. A lot of people take antidepressants.
Okay, the antidepressants are not addicting. It's the anti-anxiety medications that are addicting, the benzodiazepines. Okay,
Name some of the addicting drugs.
okay, the benzodiazepines are things like Xanax, Valium, Ativan, Klonopin. Those are all in the class of the benzodiazepines, and those are all potentially addicting.
And then the antidepressants would be
Prozac, Paxil, Zoloft, Lexapro.
Wellbutrin, Prestige, Effexor.
There's so many out there. Yeah.
There's a whole list
They're not
of those.
addictive.
and they're not addictive.
They're not
No,
addictive.
but they can be used for anxiety, but they're not addicting.
It's good to know. I didn't even know there was a difference between the two. Are there physical and environmental factors that make someone an addict?
Yes. Genetic plays the main role, but the environment and your family environment or the society is contribute to your addiction.
If you have the genetic loading, you also have to be exposed to the drug, or you're not going to be an addict.
Exactly.
I mean, you have to have an environmental exposure.
All right. Can you cure an addict, truly cure an addict?
It's a treatable disease.
We
It's-
never say cure.
Okay.
We say treated,
Treat.
in recovery. We never say cured. It's just like if you have diabetes or hypertension or asthma. We say you're treated. You're never cured. You need to take care of this disease every single day. You need to take care of your recovery every single day. Just like if you're diabetic, you need to take care of your diabetes every single day. You can't have donuts for lunch and expect your blood sugar to be normal. It doesn't work that way. You need to take care of your recovery every single day, and you'll be all right.
Majority of the addicts recover. They live very fulfilling life after they recover. There's only minority of these addicts which you see, usually they need that support most of the time.
We were saying, in all these new addictions now with cell phones and smartphones, what do you see in your office?
Well, I was telling you, in my office, people used to, in the waiting room, people used to come and read books or newspaper. Now you see everybody's sitting there checking Facebook, their status. So they're addicted to different things now. The technology has changed.
Yeah, and video games for kids. We'll talk about that in a
Yeah,
few minutes, but we'll get to all of that. Do you treat? I mean, you must see everything.
All kind of addictions we treat in office practice. Alcohol is very common. We give a lot of medications for alcoholism. They give Camprol, Revia, Antabuse. If you are addicted to nicotine, which was one of your list there, we give like Chantix, Wellbutrin. For opiates, they give Suboxone, Methadone. So those are the things we use for addiction.
So you do treat with other medication these addictions?
Yes.
Talk about, I was blown away when you said, you said, Liz, we start at age 16.
Right.
We don't, and I thought, age 16?
Yeah.
Dr. Verma, do people get addicted at
Yes.
any age? I'm surprised.
It's the genetics. It's the genetics that predispose to them. The people, there's certain personality traits you can see in a kid that they will become addict. One of them is if they start doing drugs before age 18, okay, and they develop early tolerance. They start with one drink, and within few months, or, a few years, they're drinking full bottle. So you can tell those kids will be addict. So I think the program like this definitely helps those kids before they become a full-blown addict.
What do patients fear most when they come into a rehabilitation facility?
The biggest thing they fear, first of all, they don't know what to expect when they walk in, so that's scary. They fear the pain of withdrawal. They fear that they're going to be sick, and that's very scary to them. They fear giving up that drug that's been a friend for them. So we try to make the physical withdrawal process as comfortable as possible. That's very scary.
What do you go through in withdrawal? What happens?
It depends on what the drug of abuse is. If you're going through an opiate withdrawal, it feels like the worst flu that you've ever had times about 100. It feels horrible. Your bones ache, your muscles ache, you're nauseous, you might have diarrhea, your nose is running, you feel horrible.
With alcohol, you see, the change. You sweat a lot. Your blood pressure, your pulse goes up and down, and they get very anxious. They get agitated. Sometimes they can even have seizures when they are withdrawing from alcohol. Yes.
Yeah, it's a serious medical issue.
Yeah.
So that's very scary for a patient. So that's probably what they fear the most.
Kick their habit.
As I said before, the majority of them do kick the habit.
Which is good.
Yeah.
All right, now we've talked about chemical dependency, but there are many other addictions, and addiction includes many behaviors. Spoke a couple of weeks ago when we were working together. He said that he doesn't think he could even begin to do this without therapy. Mm-hmm. How important is it when you have a life-changing experience like he does?
Actually, therapy is needed before and after so that he can be mentally prepared for this big change he'll go through in his life. As we talked before, also after he gets the surgery done, his personality will change. His look will change, how he looks, how people talk about him, how people look at him, everything will change. So get used to all these things. Therapy also is needed to see if he has any other underlying disease going on. Okay, any anxiety or depression, those things should also be treated. Maybe he was using food as a treatment.
Mm-hmm. Okay. All right, let's get in briefly. We don't alcoholism, and I just wanted to bring up one final graphic, and it says, I was talking about fires. I think it's interesting, and can you guys pop that one last graphic up? Alcohol intoxication is associated with 40 to 50% of traffic fatalities, 25 to 35% of non-fatal motor vehicle injuries, and 64% of fires. So it is the #1 addiction out there, and those are the results. I just want to thank both of you so much for being here. Absolutely wonderful show, and like I said, with everything going on in the news, I really do appreciate the fact that you both came in today. It's a very timely subject. Dr. Verma, Dr. Lennon, thank you so much.
Thank you.
And thank you all of you for being here. We're here again. We'll be back with more of Focus Wellbeing. And we thank you so very much for joining us tonight. Go online and check out our Facebook page. We'll have a question for next week's show. Thank you for joining us, everybody.
This program is brought to you by the members of WCNY. Thank you.
University Hospital, Central New York's only academic medical center where physicians practice what they teach. Knowing changes everything.